I was having trouble remembering things. I would forget to take medication, or I couldn't remember where I placed something.
There were some slight changes, but what really jumped off the page for me is that we went to a Virginia hospital for a doctor's appointment. I dropped her off, and she called me on the phone, and she was a little upset, but she said she couldn't remember what a doctor's office was. So that's what kind of really drove something home.
The fact that I would get agitated over not being able to find a doctor's office, while it was frustrating, it helped me to see that, yes, my memory was not functioning the way it was.
The number of Americans living with Alzheimer's disease is about 6.7 million. That's projected to increase because the number of individuals at older ages, when they are most susceptible to Alzheimer's, is projected to increase over the years. It is a disease, therefore, with enormous physical, emotional, financial toll at the individual level and at the societal level.
A major challenge for Alzheimer's disease has been a lack of reliable biomarkers, making it hard to diagnose, monitor, and test effective treatments. The foundation for the National Institutes of Health was the convener of ADNI, the Alzheimer's Disease Neuroimaging Initiative, for over 19 years.
This was an observational trial in Alzheimer's disease that's an unprecedented open public sharing of all types of clinical data. That became a foundational resource to understand the disease and to understand the progression of the disease.
The Foundation for the National Institutes of Health played a pivotal role in catalyzing collaborative efforts amongst researchers, clinicians, and industry partners to advance AD research and drug development. After the success of ADNI, the Accelerating Medicines Partnership for Alzheimer's Disease, or AMP-AD, started in 2014 with FNIH management.
AMP-AD is a public-private partnership with the government, industry, and philanthropic organizations, all with the goal of accelerating the development of new therapies and diagnostics for Alzheimer's disease.
One of its key components was focused on harnessing the power of big data and the emerging molecular profiling technologies to learn faster about the complexity of the disease.
We also wanted to drive the incorporation of modern biomarkers into clinical trials, and indeed AMP funded the incorporation of tau PET in particular and other biomarkers into 2 prevention trials as one of its key goals.
What biomarkers allow us to do, both by brain imaging and more recently by fluid markers in the spinal fluid or in blood, is to identify the changes that occur in Alzheimer's disease even years or decades before symptoms.
And this has really enabled very early detection in people that may be suffering from things like mild cognitive impairment or early Alzheimer's disease.
We were referred to the neurologist. After seeing him a couple of times and starting to run some tests, I honestly had a diagnosis of mild cognitive impairment. That was it, MCI.
It's an exciting time. We've seen a rapid advancement of drug development for Alzheimer's disease in the last 10 years that has largely been spurred by biomarkers and better understanding of the disease pathophysiology.
Facilitating and making multiple industry cooperate in a pre-competitive space was something that only organizations like FNIH can do, and they did a great job in assembling and getting them to agree to do this at a scale that really could not have been possible by any of the industry by themselves.
FNIH is expert in team science. We provide the support, the planning, and the management of these private-public partnerships. We're solving the problems that matter most to patients.
In AMP-AD 2.0, we saw the opportunity not only to expand in a lot of the work that we were doing in target discovery, biomarker discovery, but in addition to that, in making sure that we were able to embrace and bring in populations that were traditionally underserved and understudied.
The strides that we've made over the last few years have really come down to not only the researchers, but the participants and their families who volunteer for these studies. Without the participants, we will not find cures.
One last hug because
I have a disease that, no one knows where it's really going to go. Usually the idea is progression. The whole purpose of being in the study is to limit the progression of it. The NIH Foundation brings to it ultimate support of the person and not just the health care of the body. And I thank you for that, because I was privileged to be part of it.
We had the opportunity to benefit from that advanced research.
It's been life-changing and it's been life-saving. It has made it easier for me to get the quality of care that I needed, but also not to allow this disease to rob me of my life.